Hi, my name is Ricky Hernandez, and I'll be going over glomerulonephritis and its diagnosis, epidemiology, pathophysiology, medications, as well as its implications towards exercise. So let's begin. What is glomerulonephritis? This is where there's inflammation at the filtering structure of the nephron within the kidneys. The National Kidney Foundation defines glomerulonephritis, or GN, as a group of diseases that injure the part of the kidney that filters blood. When the glomerulus is injured or inflamed, it cannot get rid of waste and extra fluid in the body. Some of the ways to diagnose this disease are by a urine test, a blood test, a kidney biopsy, or by the GFR, or reduced glomerular filtration rate. A urine test or urinalysis may show red blood cells or even white blood cells in your urine. This could be an indicator of possible damage to the glomeruli. Blood tests can provide information about kidney damage and impairment of the glomeruli by measuring levels of waste products such as creatine and blood urea nitrogen. And a kidney biopsy involves using a needle to extract small pieces of kidney tissue for examination in order to help determine the cause of inflammation. As well as the GFR is the rate at which kidneys filter waste and extra fluid from blood. This is typically measured in millimeters per minute, and there's a decreased GFR instead of an increase because the inflammation and the glomeruli is way too congested with unneeded particles. So there's two different types of glomerulonephritis. There is nephritic syndrome and nephrotic. Nephritic syndrome is the leaking of red blood cells and small amounts of protein into the glomeruli. This can be developed after an infection such as a strep throat. Maybe the patient gets strep and the strep wasn't treated appropriately, and typically this develops what is called a post-streptococcal infection. And your immune system creates antigen-antibody complexes to help fight that bacteria. And these complexes eventually collect into the glomeruli and inflame it, letting the RBCs and proteins leak through. This could be developed over a short time, and can possibly go away without any treatment. Typically, the age is from 2 to 10, but you can get this at any age. Nephrotic syndrome is a little bit more dangerous because there is proteinuria, or leaking massive amounts of protein. And not only are you losing albumin, you're losing those proteins that help decrease clot formation. This can be developed from other diseases such as lupus, heart failure, and diabetes, and can take several years to develop, and it is a way greater risk for kidney failure. So the epidemiology and risk factors for this disease are hypertension, history of renal diseases, history of dyslipidemia, IgA nephropathy, Buerger's disease, gender, it's more common in women than men, and tobacco use. IgA nephropathy is when an antibody called immunoglobulin A gets lodged into the glomeruli, and it inflames it, letting the same thing seep through and damage your nephrons. Common causes of this disease are high blood pressure, diabetes, cancer, strep throat, bacterial infections, viral infections such as HIV, hepatitis B, and hepatitis C, immune diseases such as lupus, Goodpasture syndrome, and IgA nephropathy. Another reason could be from regularly taking more than the recommended dose of non-steroidal anti-inflammatory drugs such as ibuprofen or aspirin. So according to the Texas Medical Association, in 2015, kidney disease was the 8th leading cause of death in the United States and the 9th leading cause of death in Texas that same year. An estimated 31 million people in the United States, or 10% of the adult population, have or had a chronic kidney disease. So the pathophysiology of the nephron. So there are millions of nephrons, and they are the functional unit of your kidney. They help produce your urine by filtering blood. Blood enters into the afferent arteriole right here. I don't know if you guys can see my cursor, and passes through the glomerulus. There is a 3-membrane barrier that stops unwanted particles getting in. Once the filtrate is inside the glomerulus, it then passes through the Bowman's capsule and then goes up the proximal tubule. Now, 95% of this filtrate is being reabsorbed in this tubule. Then the rest of the 5% goes down and it gets diluted. Goes down to the Lupus Henle, comes up, goes to the distal tubule, and then out of the collecting duct as chloride, sodium, potassium, creatine, and urea. Then men, usually they produce around 180 liters of filtrate a day, but 1 to 2 liters of urine is actually produced in one day. So that means that there's only 1% of that filtrate that leaves the nephron, and 99% of that filtrate enters the nephron is reabsorbed. So the pathophysiology of GN, one thing that GN affects is GFR, what we talked about. And remember, the glomeruli is too congested with those unneeded particles from inflammation to actually work properly. So these are the antigen-antibody complexes that I was talking about earlier, that somehow they got into the glomerulus and they will damage the nephrons of the kidney overall. And some of the symptoms of this are hematuria, which is blood in the urine, and your urine would look like a tea-like color or like a Coca-Cola-like color. Proteinuria, this leads to low protein in the blood due to it being lost exiting the nephron. And this lowers the amount of albumin in the body, and albumin actually regulates what's called oncotic pressure, which is what keeps water inside the capillaries. And when we lose this protein, there's nothing to keep that water inside the capillaries or capillaries. So the fluid starts going out and moving out into the tissues and producing the swelling, which is edema. There's a low urine output, which is less amount of that blood is being filtered. And hypertension, since they're retaining a good amount of that sodium, since water is scarce in the nephron due to the concentration of unwanted particles. And then and salt doesn't follow the water because it's not much of it's leaving the kidneys. And then there's puffiness in your face due to that edema, and then extra fluid in your lungs. So some of the risk factors of this are exercise should be a low intensity, and strenuous exercise may have adverse effects. According to the ACSM, risk assessment and pre-participation screening should be done on an individual basis among patients with kidney diseases, as they are likely to be at a higher risk of exercise-induced induced death than the general population, but also stand to benefit more from increasing activity. Strenuous exercises may have adverse effects regarding the permeability of the glomerular membrane due to lactate, causing changes in various blood protein permeability. And lactate is what builds up in your endocrine system during intense exercise when cells become hypoxic or surviving off of a lack of oxygen. And this can lead to various changes in blood protein permeability. So that's why it's very important to keep physically active at a low intensity, but do not stop exercising because it's very important for this population's overall health. And exercise is fantastic as it improves muscle functioning. It lets you have a better blood pressure control, improves muscular strength, and as well as lowering level of blood fat such as cholesterol and triglycerides. So some of the medications, you may be advised to reduce your intake of foods that contain a high amount of salt or potassium. Corticosteroids are being used. One of the popular ones is prednisolone, and what corticosteroids are used for is to reduce swelling and suppress your immune system. Angiotensin receptor blockers help to vasodilate your blood vessels in order to help lower your blood pressure. In some severe cases that can't be improved with other treatments, someone may require a kidney dialysis, which is a treatment that takes over part of the kidney's job and removes waste products from your body. A kidney transplant, where a healthy kidney from a donor is surgically implanted to replace the patient's kidney. And treatments can change depending on the severity of the symptoms. These medications are commonly prescribed at the top, even if your blood pressure is not particularly high, as they can protect the kidneys. So as a case study, we do have a female, age 25. She's a non-smoker. She has very high blood pressure, 160/100. She has a family history of mom having type 2 diabetes, BMI of 20.5, which is fine. Total cholesterol of 175 milligrams, which is totally fine as long as it's under 200. Blood glucose of 90, it's fine. She has some symptoms of swollen hands, swelling around the eyes, shortness of breath, blood present in the urine, as well as foamy urine. And foamy urine is due to that massive amount of protein leaving her nephrons. So you can tell that she has some symptoms of GN, so we want to have a referral from a doctor. Currently, she's not on medications and sedentary lifestyle. However, she is interested in a comfortable level of physical activity. So for her, I would prescribe aerobic exercise, resistance training, as well as flexibility. Aerobic exercise, such as low-intensity aerobic training. Good examples would be walking, light swimming, and dancing, and then eventually progress to 30 minutes a session for 3 non-consecutive days a week at the minimum. Rest when needed is extremely crucial. Resistance training, we want 20 to 40% max heart rate. Simple single joint exercises with low intensity strength training may be beneficial to the program. Low weights with high repetition is recommended and should be a comfortable push with every movement. 2 to 3 sets of 12 to 15 reps, 3 non-consecutive days a week at the minimum. Flexibility, light to moderate stretching, 2 days a week for a little over 10 minutes. For those at risk for falls, include exercises to maintain or improve balance. Stretches should be held until slight discomfort is felt, and then stretches can also be held for 10 to 30 seconds. So during this, her breathing should not be so hard that you could that she could talk with someone, that she couldn't talk with someone. So it's important if she would like to monitor her intensity, to have that person be with her, just to have a conversation while maybe she's on a bike or just walking in that swimming pool. She should feel completely normal within 1 hour after exercising. If not, she needs to slow down next time. And if you guys would like more information on this disease, please do not hesitate to go on these websites. They're great websites. I added some of the information from their websites to my PowerPoint. And that is it. Thank you for watching. Like and subscribe.